All right, so we're about to go live right now.
Great.
Perfect. I would like to welcome you, Mr. Sam, on the show. This is episode 27th of The Health Show. I'm super honored to have you here. How are you doing today?
Well, Asad, it's great to join you today, and thank you for inviting me. Please call me Sam, and really looking forward to the discussion with you. There's so much going on in the world, and I'm sure we'll touch on lots of interesting topics today.
Thank you so much. So let's begin without a delay. First of all, I would like to ask you, who is Sam Shah? What's your story? What are you all about, and what is your inspiration?
Well, I think that's a really difficult question. So, well, I am a clinician. I'm enthusiastic about technology and public health, but I guess my story, like many other people, is it's a complete mixture of my experiences in life that have brought me here. I've grown up in family living in different parts of the world, and of course, all of those things have had an impact on what and who I am today. But right now, I am found future health for the Ulster University, and so I'm not sure if I've lost
Yeah, there
my
seems to be a little
audio,
lag. You can hear me, right?
but I guess I will carry on. Can you hear me?
Yeah, I can hear you, but there's just a little bit of lag. I think.
I see.
All right, but we can move on. All right, so the next question is about your digital health endeavor. So I want to ask, tell us about your the global digital health initiative, and what it's all about.
I guess digital health exists. Around the world, we've certainly seen a movement where telehealth has come about, where telemedicine is a bigger thing, and there's a much greater focus on infrastructure, technology within health services. So within global digital health, part of this is about sharing learning in different parts of the world, talking to lots of individuals and trying to encourage them around developing themselves, their workforce, bringing about new ideas. That could be new technology. That could just be about sharing technology and other things too, like simply getting involved in global digital health research. So all of these things are part of global digital health. And now I spend a lot of time working with companies and governments and other entities around the world, very much sharing learning and trying to bring about connections to help further digital health. And really, what digital health is about is trying to reduce inequalities, improve access, and improve outcomes in much the same way we would do in any other part of healthcare. But it's doing that by using technology, data, and applying new ways of working.
Great. Thank you so much for sharing that insight, Mr. Sam. And so just to come back to question number one, because we had a little problem. I want to ask, what's your story? If you can just go through, your story again one more time.
Yeah, sure. Look, I'm a clinician. I'm super enthusiastic about public health, and I'm involved in technology and have been for some time. And in terms of where I started from, I, like many other people, started off thinking I wanted to go into healthcare as a clinician, had some experience of doing that, working for a family practitioner.
Oh,
And
that's
then
brilliant.
I soon realized I had an interest in tech. Yeah, and of course, as well as having an interest in technology, I also got involved in retail technology, in financial services technology, and sort of other areas as well. And soon on, after that, carried on in my training in healthcare, and afterwards decided to sort of split my time between public health, clinical practice, and then started getting more involved in technology. And as time went on, that became a greater part of what I did.
That's just great. Thank you so much for sharing that, Mr. Sam. So my next question is the most exciting question of this show. Um, and it's this. Sam, if you had all the time, all the energy, and all the money in this world to do anything to keep yourself healthy, what would you do and why?
Wow. Well, don't I just wish I had the golden answer to this? Uh, and Asad, I wish I had as much energy as you. Me, uh, it would have to be investing more time in sleep. That's for sure. I certainly don't do enough of it, and I would certainly put a lot more time and effort into sleep. That's probably the first area that I would sort of focus on. The second is probably to do a lot more exercise. So I'd probably invest a bit more in exercise, be that exercise at home, sort of more structured exercise, and just doing more activity would probably be another big part of what I would do and try to do, at least if I'll ever get there. Less coffee and eating a lot healthier. And what I mean by that is, having a balanced diet and probably spending a little less time in front of screens. And of course, most importantly, is add all the resources available to me. They're probably the things I would invest in.
Wow, that's great. Thank you so much for that. So these things are very simple, but your approach is very significant. I mean, it's very important, just like you mentioned. Um, so my next question is something that I believe is not talked about enough, right? I think mental health is not addressed enough. I feel like it's not given the due attention it deserves. I feel like even if people talk about mental health, they only talk about the problem and nobody focuses on the solution itself, right? And that's my basic thing. That's my concern because people want talk about building a culture where it's okay to go to therapy, where it's okay to just like you go to gym to exercise for your body. It's okay to go to therapy to exercise your mind, right? And so I want to know what's your take into mental health since there's so many stigmas attached to it. Sam, can you hear me? All right.
I can hear you now. I think I cut out there for a moment, but I think your question was about mental health. I think.
Yeah, it was about mental health. So basically, just like fasten it up, I'm basically very concerned, that people don't talk about mental health. It isn't given the due attention that it deserves. And even if people talk about mental health, they talk about the problem. Nobody focuses on the solution. I want to know what's your take into mental health.
Yeah, well, look, I think the first thing is it's ended up becoming a taboo topic area. People don't really talk about it enough, and at the end of the day, there are so many different types of issue within the spectrum of mental health. So the first thing we need to do is make it more acceptable for people to discuss mental health, to make it something that is less sort of taboo and something that's more mainstream, and expect and accept that everyone at some point in their lives will experience some form of difficulty around mental health. So that's probably the first thing. And that's the first thing that we need to really do, which is make it accessible and expect that everyone can talk about it freely without feeling constrained. But I definitely don't think we do enough around mental health. We don't do enough in terms of talking to each other about it, and we don't do enough about focusing on it about ourselves as clinicians, and we don't do enough when talking to our patients about it. And part of this is history, especially in Asian cultures, where it's not necessarily the sort of thing that people like talking about, but ultimately everyone will experience some form of poor mental health at some point in their lives. So as part of what we all do, we've got to make sure that it's more accessible and try and improve the services available. And that's not just about doctors, but it's about all sorts of other services, psychologists and other types of mental health service provider. And then we've got to find ways of helping people tackle it in terms of solutions. Better sleep, better exercise, time out, trying to reduce screen time. All of these things are important to give people a break, to allow people to have time for themselves. And certainly in certain cultures where there are high pressure environments, we've got to find a way to allow people to balance that and recognize that a big part of physical health stems from mental health. Because the reason a lot of people present with pain or other symptoms often stems from underlying mental health conditions. So it's so important that we take more time to deal with mental health. Because if we don't, we end up with people not in employment, not able to work, they're not able to contribute in a meaningful way because we've held them back. But if we make it more accessible and we try and deal with some of the problems with some tangible solutions, like basic things like sleep, exercise, and access to talking therapy, these things will help. But we have to do so much more, especially in those parts of the world where culturally there's still a lack of acceptance that mental health is as important as physical health.
Definitely. Thank you so much for sharing such a beautiful insight, Sam. I hope that's very, very valuable. My next question, since you're an expert in digital health, you're an expert in health basically. It's very important to have you on the health show. It's very important to ask you things related to health, and that's my basic question. My question is, if you can somehow give us three key insights into a better sleep, better diet, and better exercise routine for the people listening to us and watching us right now.
Well, so I think, like most of your participants on the show, I guess I don't have anything secret. And very soon, you too are going to be an expert joining a global panel. But I guess if I think about and reflect on my own experiences, my own patients, and what I've seen in the system, the solutions and the insights are really simple. If we think about diet, the first thing is trying to just have a balanced diet, trying to avoid lots of refined sugars, trying to avoid having very sort of mass-produced fats and stick to simple fats from things like naturally occurring produce like avocados, for example. Have a balance between carbohydrates and protein, not too much of one or the other. And the other thing is drink lots of water. On the one side, this might sound really simple, but it's actually quite difficult to do, especially when we've all got busy lives, used to having things rapidly, especially amongst Asian diet. It can often involve lots of refined sugars and fried foods and things like that. But if we can find a way to minimize those, to think about the times at which we eat, to try and control our intake and think about just measuring how much we have so that we don't have more than we need, those are really basic things we can do, but we can all do a little bit of that. Now, I accept people don't make free choices. They don't make choices because they can freely do it. Most people make choices because they don't have any other choice. But if we can make those choices easier, we might make better dietary choices. When it comes to things like sleep, I guess, like most people, I probably don't have enough sleep. And many of you probably don't have enough sleep either. But take a bit of time to try and get in a good 6 to 8 hours if you can. And do things like think about a space that's quieter, avoiding distractions like light, and even things like avoiding your device too close to when you go to sleep. Now, don't get me wrong, whilst I'm saying this, avoid using your phone as your watch or your clock. Instead, get a clock that's not connected to anything and put your phone away in a different place so that you're not tempted to use it in the middle of the night. And you're not tempted to use it too close to when you go to sleep, because that light from your device itself can interact and impact on the way in which your eye movement happens and, of course, how the quality of the sleep that you get. So they're basic things. But when it comes to health, well, that's far more difficult. Because our health is made up of so many different things. It's made up of everything relating to education, environment, water, housing, and of course, it relates to the way in which we live our lifestyles. So health is much more challenging. There's some basic things that we can all do. Are those things around eating a little bit better, sleeping a bit better, drinking a lot more water, and just thinking about the way in which we look after ourselves and keeping time for ourselves. That's a really important part of it. And whilst I'd love to be able to say technology is part of the solution, it still isn't quite down to share ideas around health. But the important thing is to have balanced vitamins, to make sure that you have people to talk to, share ideas, express yourselves. And they're all important parts of good health.
Great. Thank you so very much for this. I feel like you've just laid down very beautiful points, very key points, very insightful things for people to consider. My next question is about, now I'm moving the show towards more, self-awareness part. And my question is, what has been your life's biggest failures and what did you learn out of it?
Well, the first thing to say is I've had so many failures in my life. It'd be difficult to count them all. And many of you will also have failures. Certainly don't be scared of them and use them as part of your learning and as part of your own development. And I've had failures from everything from interactions with my staff, my clinical practice, my personal life. There are failures in every part of it from which I've, of course, learned. But I'd certainly say the biggest was when I was in a different sector, not in healthcare, but in shipping. And I guess that failure resulted in a pretty difficult deal in a shipping transaction. And that whole transaction didn't go well at all. And we ended up losing a ship and a rig in that process. These are big objects which are worth a lot of money. And the family business I was part of at the time didn't do too well as a result of that big failure. But I guess if I think about what I've learned from it and the learning, it's no different in that industry to healthcare or my personal life. And I guess I could have done more to plan ahead, foreseeing some of the problems, not all of them, but I could have planned ahead for those scenarios much more realistically. So that's probably the first thing, which is to think a bit further ahead and learn from that environment. Think, could this happen again? And also taking more time to discuss these things and with others, and accept that none of us know all the answers to these things. The next thing, though, in that is think about resourcing, whether that's people resource, money, time. These things can run out quickly. So being realistic about the resources you need to make something happen are equally important. Then there's other things. Contracts and agreements are all very interesting, but in most places of the world, they're meaningless. Relationships between people are far more important. And I would say that's a consistent theme in every failing. That communication relationship piece is absolutely essential to trying to avoid things going wrong, or at least if you can't stop them going wrong, making them better when they do go wrong. But then there's the other thing, be realistic. So in terms of insights, I would say be realistic about cost and time, be realistic about what you can achieve in a period of time, and also think about people. People are so important. Hire the, but these are going to be people that you're going to have to be able to work with, have honest debate with and discussion with. And pick people who are not like you. Pick people who are going to challenge you and welcome that challenge. And that will help at least avoid some of those failures. But I suspect I will still fail again, and many others will fail again. And accept that that's part of the way in which the world works, in that we will fail. What we have to do is reflect on it and think about what we'll do differently next time.
Great. Thank you so much, Sam. I feel like the points that you just touched are very insightful. I mean, they're very valuable. I can totally relate with the idea, with the whole concept of people management and building connections, and just not just for the fact for your own self, just for people, for to be better human beings together. I feel like not just in an organizational point of view, not just in an enterprise point of view. I feel like as a global point of view, as humans, we need to build a culture around this. We need not to be more selfish. We need to be more selfless, right?
I mean, Asad, I think you're completely right. That connection that we need to have between human beings to share more. But that requires a change in the way we see vulnerability, right? We have to also accept that we have to show some of our vulnerabilities and share some of the things that are not working. And that's really hard to do because people aren't often very good at sharing what isn't going well. So culturally, we need to change things. But you're quite right, Assad. We have to make sure that we change the way in which human society, culture deals with failure and making it more acceptable to talk about these things and not necessarily criticizing what's gone wrong, but trying to constructively move on from it and work out what didn't work and what do we do to make it better.
Great. Thank you so much, Sam. My next question is about NHS, and this is something that not only is a concern of myself. I see this growing concern in a lot of people who are graduating from medical schools outside the UK. And so, what do you think? What's the future of NHS as an organization? We're seeing the development of we're seeing the overwhelming burden on NHS because of a huge demand and a very less shortened supply. We see that people want to privatize NHS. We see there's a lot of growing concerns around the world because NHS is this one, it's the only organization that I know of personally that has free accessible healthcare to every single person in the UK. And that's just something which is mind blowing because the whole concept of NHS is so beautiful. We don't have those systems in the US or everywhere in the world. So that's interesting. And so my question is, where do you see the future of NHS and for IMG doctors, and why do you think it's going that way?
Well, I mean, Asad, I think you make some really valid points there on how the system is perceived. And for a lot of people who are watching or listening, they might not know that, of course, as one of the biggest publicly funded health systems in the world, has almost 1.3 million employees in the NHS. And in England, it has a budget of about 140 billion pounds. And in the other countries in the UK, it also has a significant budget. So in the UK, we spend about 170 billion pounds in total on healthcare, which is significant. And it is still one of the biggest publicly funded systems that provides accessible care to all. Now, there are some parts of the NHS where patients have to pay a co-payment, but it's still a very small co-payment compared to what actually happens. But it's a system funded based on taxation. And the difficulty here is that taxation can't increase indefinitely. So we have to work out in a system like the NHS, how do we make it more affordable or more accessible, and how do we still reduce inequalities and provide high quality care? Now that's really difficult, that's challenging, because that requires a fundamental different model, a different way of working. So things are already changing, but we can see the same trends elsewhere in the world. And putting aside the payment method or the funding method of the service or the system, the tenements, the ethos, the values are probably not dissimilar to other health systems. Whereas clinicians, we're always trying to do the best for our patients, trying to reduce harm, improve outcomes, and improve safety. These are things that are probably similar to your own health system. And I'm sure, the clinicians that have training in your system are very similar to the clinicians that are training in our system in the UK. And I certainly know that the same exists in other parts of the world. So as a system, I doubt the NHS is going to go away anytime soon. And I think it's still going to be an exciting place to learn, to work, to develop new ideas, and to treat the population. But where I think things are going to start to change is other parts of the world, as health economies change, will also start to develop and develop further. So historically, the UK was a very attractive place for international medical graduates. I know lots of good colleagues have come from Bangladesh, Pakistan, India, and other parts of the world where they've come to the UK, and often they've come to the UK and stayed in the system. Where I think things are going to change now, as those economies start to grow, I think people are more likely to come to the UK for a period of time, learn and develop, gain more skills, but I really hope they're able to take those skills back to the places that they know and that they developed in themselves to be able to develop those systems and reduce inequalities and improve access and improve outcomes by providing really good quality care and developing international networks. Certainly, if I think about the students that I've taught in the last few years, I've been really lucky that we've had students come from lots of parts of the world and take placements with us and spend time in the UK where we can exchange ideas. And now to the point that we have networks globally where we can share and exchange ideas. Because the one thing I would say is whilst there's lots of good things about Western medicine and about the medicine that's practiced in the NHS, it's not unique. And I really hope the flip side will happen, where we develop and learn ideas that come from other parts of the world that get imported into us through international medical graduates. But I still think the UK is an attractive place to come and develop and learn for a period of time. And I would certainly encourage international medical graduates to really look at the opportunities that we have in the UK and think about whether they want to come here for a period of time. I appreciate that's a big investment in terms of learning, resource, but it can be very rewarding. And it's an opportunity to learn new ways of working and new skills, which one day will make a difference in other parts of the world. But it is still an exciting place to be. And despite all of the stories in the press about privatization, I don't think the system will really be privatized, but I definitely see a better mix of public and private working together. But that's always been the case. Most of what we call family practice in the UK is independently provided. It's not directly provided by the NHS, but it's provided for the NHS. And I think the same will continue to happen. And we have a really good, healthy relationship between the private technology sector and the NHS. So I certainly see this kind of thing continuing to happen. And I'd really recommend that international medical graduates look at the range of career options we have, whether you're a doctor, a dentist, whether you want to go to surgery, or it's nursing. There are so many opportunities to learn and develop, educational programs, training programs, and all of these things will provide fulfilling experiences that will make a difference again one day in other countries in the world.
Great. Thank you so much, Sam, for sharing this. And I can totally relate with your point. I had Professor Shafi Ahmed on this show a couple of weeks ago, and he mentioned the same fact. When I asked him this question, he said, NHS is not going to be dissolved. Rather, the systems in the US and other countries, they're the ones who are going to follow the same, concept of NHS, and they're going to apply that in years to come. And we're all going to see that. Why? Because NHS is a very beautiful concept. Having healthcare accessible to everyone, which is patient-centric, it's just amazing. But the concern that I have is, even with, you've cleared the point, you've cleared the whole frenzy about the stories and the privatization things. Another concern that I see is, a lot of UK doctors, UK graduates, leaving UK because they think NHS is not doctor-centric. It's not good enough for doctors. What do you think about that?
Well, I think like any health system, it changes. And the system that I might have trained in might be different to the system today. And that can be quite difficult to accept, especially when resources are very limited. But if we still take a step back and look at it as a system, it is a difficult system to work in, where resources are scarce, where we all just want to do our jobs, but the bureaucracy and the administration is one of the barriers that we have to contend with. So what I tend to find is there are some doctors, a very small number, that leave the system. Some of those go overseas for a period of time. Some of those come back after going overseas. But just as many doctors might be leaving the system to go elsewhere, it's equally an attractive place for doctors from other parts of the world who want to come here. So I think one of the benefits of globalization in healthcare is that we have this movement taking place. And you're quite right. For some doctors, they may not want to stay in the system. And I can totally understand why, and I can empathize with why, and I understand their reasons for wanting to move and change. But just as many are thinking about going elsewhere, an equal number want to come into the system because for them, they're coming from a place where they can bring in new ideas, but they will learn. So I wouldn't be too worried about the number of people leaving. But I think what's important is that maintain it's an attractive place to provide high quality healthcare. Now, we all have to make choices, and it's never going to be an easy choice, especially when resources are scarce. But I think the good thing is it's a system where people are collaborative, where there's a community of those people wanting to educate one another and develop. And it will never be perfect. No system in the world is perfect. And the demand for healthcare, wherever we are, will always far outstrip the supply, especially in a publicly funded system. But I'd like to think many of those people who go away for a period of time and learn in other settings may sometimes choose to come back. Sometimes they may not. They may decide to stay elsewhere. But that's the benefit of a global healthcare system, where we can all move around the world. And it still means that by doing this, there's almost a marketplace in itself for people moving around in education and training within the medical workforce.
Great. Thank you so much, Sam, for sharing that. I totally believe in what you're saying. I feel like, and I think NHS is going to be a force of nature. It's going to be even bigger and better than before.
Yeah, and I think like anything, it evolved, right? So in the same way, the system in places like Pakistan, India, Bangladesh, parts of Africa have evolved and have continued to strengthen. Take the Middle East. In the Middle East, there's health systems that have evolved. And it's those mixture of cultures where people have grown and developed in different parts of the world coming together to make that happen. And that happens because people are able to learn and develop in other systems and then take those ideas to different systems. So if we didn't have that movement in clinicians, everyone just stayed where they were, we wouldn't have that spread of knowledge. Now, you might think, well, that's only because the system doesn't work perfectly. Maybe that's the case. But at the same time, by it being slightly imperfect, like any imperfect market, we have that movement. And that brings about new ideas. So it is difficult. It's never going to be easy. But I think in the very way that medicine has evolved, technology has evolved, I think health systems will evolve. And now, as we move towards sort of accountable care organization type models in lots of places in the world, I think, again, the NHS will both itself evolve, but also it will share its learning in its new way of approaching the organization of healthcare.
Great. Thank you so much for sharing that, Sam. My next question is about what you do. It's about Global Digital Health Initiative, future of faculty health. Talk us about this. Especially in Pakistan, we don't have this awareness about digital health. It's just growing. We have these startups growing, evolving and growing gradually. We don't have a digital healthcare system just like you guys have in the UK or it's in the US. Talk to us about it. Tell me, what do you see the digital health system, the digital health care in 10 years from now, in 20 years from now? What's it all gonna be? Just like I had a talk with Professor Shafi, he's dubbed as the virtual surgeon, and he told me, artificial intelligence and 3D rendering, that's all gonna come, and it's gonna come very, very fast. But I want to know what you think about it. What do you think digital health is? How does it impact people, and where is it going in 10 years from now?
Well, I think digital health, like any term, will change in definition. It's unlikely to stay static. The definition of digital health today is probably not going to be the definition of digital health tomorrow. So I think digital health is moving towards what we often think of as e-health. You might say they're one and the same thing, but I'd like to think of them slightly different. I think of e-health as being the entire combination of a full range of technologies, ways of working, platforms, services, and even workforce. And the entire connectedness in an ecosystem, in a digital ecosystem, is where I see the system going to, where I see health systems moving towards. So imagine that future world where we take all of the future or post-digital technologies as we think of them. And Professor Shafi is quite correct, I think, and I agree with him, in that the AI, distributed ledger technology, extreme reality and quantum computing are things that are coming at us in healthcare very fast. But I think they'll be part of an ecosystem. And like any other technology sector, take retail technology. It's moved from being online to even being offline, where the likes of Amazon or others are now having to invest again in stores so people can have that blended experience of online and offline. So I think in the digital health ecosystem, in the e-health ecosystem, we'll see a blend of the two, where we'll see some really exciting, super new technologies come along, but at the same time, you'll see a strengthening of physical services for those people that either will benefit more from face-to-face care or can't necessarily access digital care. And those two things will come together. But we'll also see some democratization. We'll see data go into the hands of individuals in the same way that you or I might be able to access our data about our finances or about other things. We'll be able to do the same in healthcare. And that will allow us all to make better decisions. So when I think about the digital health future, I think about the e-health future, that ecosystem of healthcare, combining patient insights, data about citizens, combining that with environmental data about hospital systems, and bringing those things together to allow people to make better decisions about themselves and also connect the much wider range of healthcare professionals. And some of those healthcare professionals will be within the home environment, and some of those healthcare professionals might be global. But that e-health ecosystem, the combination of technology, workforce, physical places, and the use of new technologies like the post-digital technologies. But that's going to require a shift in the culture of paternalistic healthcare, moving to one where the citizen is more in control. It's going to require a change in the way in which we regulate healthcare, both in terms of soft regulation and hard regulation. We're going to have to make it easier for people to have teleconsultations in some parts of the world, or change the regulation around the way in which we protect data to make it more secure, and adopt security standards. And then we need to think about how we pay for healthcare. Obviously, this will vary in different parts of the world, but we do need to make it simpler and more transparent for the citizen. And of course, we can't forget the big challenge in e-health and digital health is going to be interoperability and integration. If we don't solve those problems sitting underneath everything, we'll probably never achieve that future e-health space. And this requires policymakers, governments to really take this seriously and focus on developing standards that are global, and making sure that when different technology comes along, it can be integrated and allow people to have the best possible experience. But by doing those things, hopefully, by having an e-health ecosystem, we'll make healthcare more accessible, but also bring down the cost of healthcare as well in due course. That's quite important to me, and that's where I think this digital health system is going globally. What it means for me in the Faculty of Future Health is about creating programs. So many places around the world want to develop their workforce. So one thing I'm trying to do through the faculty is create 3 simple programs to develop the workforce: a clinical leadership program, a digital health leadership program, and a public health program, allowing people to pick the components that make most sense to them and their future work, making it open to clinicians and non-clinicians, and trying to blend this with some form of work-based training and placements that will give people practical experience. And by doing that, I hope they'll apply that into their future health system to make their future health system more accessible. And that's the ultimate aim. By equipping people with skills, we'll improve quality and safety through clinical leadership, we'll reduce inequalities and improve access through public health, and through digital health, we'll be able to improve the ways in which people can access those services, improve the security, safety of systems, but most importantly, improve data and infrastructure. And that's the ultimate aim of the faculty, to try and bring about the vision of a global health system.
Wow. So I'm blown off, by the way. Just to like cap it all, just to sum it up, Faculty of Future Health is about building and developing leadership, clinical leadership for workforce around the world. So let's say if Pakistan needs a couple of doctors who are trained in a certain specialty or a space or a portfolio, Faculty of Future Health is there for their services, and I feel like this is unprecedented, right? This is something that has never been done before.
Well, I think it's hopefully opening opportunities for people. There's been lots of amazing initiatives from amazing colleagues in different parts of the world to try and do this. And I think we all recognize that in our undergraduate programs, we don't give people enough training, but there isn't simply enough time. But we've now got a new movement of doctors, dentists, surgeons, others who are trying to develop themselves, become more entrepreneurial, think about how technology supports them in their workplace and take more control. We've got managers that want to skill up as well around leadership, commissioning. If there's a way we can do this at a global level and share that learning, that's the ultimate aim. Now, there are lots of amazing schools that offer programs that are global. But the problem, of course, is they're not blended. They're either completely online or they're offline. The aim here is to create that blended experience, to mix students together from different parts of the world, a little bit like how most MBA programs work, but without taking them out of their home environment. So to keep them in their health system so they can stay there if they want to and bring the benefits of the programs to their own health system, to help them develop placements that they can learn in and develop their skills. Because the aim of all these things is not to take doctors out of their health system and deplete them of knowledge and resources, but to augment that. So I hope that people from Pakistan join us on the program. I'd very much welcome that in due course. And this is meant to be a two-way program in the faculty where we use research and insights to inform the faculty, but the faculty also develops research and insights to influence other parts of the world. We're always looking for collaborations. We're always looking to collaborate on the research front, on developing programs. And at the moment, we're really lucky. We're talking to partners in lots of places in the world to work out how we can develop the model so it suits them. So it's not a one-size-fits-all, but something that's customized to share that learning, but bespoke around certain health systems.
Wow. Sam, I don't know if you can see this or not, but I'm fired up. I'm totally excited about this. And I already feel like, applying for this, I really want to get into this because I just love the whole idea of this. Thank you so much for sharing that. My
You're
next
welcome.
question. Yeah, please go ahead.
No, you're most welcome. I'm glad you're fired up. You have boundless energy. So I'm sure that you'll continue influencing many people to think about their careers carefully.
Thank you so much. That's what I aim to do with the health show. Not just about mental health, physical health, but it's also about self awareness. It's also about right career guidance, and it's also for doctors all around my circle and my community. So that's my home. That's my aim to provide maximum value. But thank you so much. Indeed, this has been a beautiful conversation. My next question is about this. How can somebody be more self aware in your opinion?
Well, self-awareness is clearly a challenging area for many of us. I don't think anyone is perfect at this, and it takes time. So the first thing is just be kind to yourself and give yourself a moment. But when you think about self-awareness, it's about reflection. But for reflection, you need some time and you need different inputs. Some of those inputs will come from other people. Some will come from yourself. But if you think about any environment and think about reflection, it comes from discussion with others as well as almost discussion with yourself. But how do you have a discussion with yourself? Well, part of this is trying to take a step back, almost become an observer to yourself, and think about something not as you going through it, but as you watching your experience with others, your interactions, and become that observer. Because the biggest learner in any interaction isn't the people in that interaction, they're the observers. So if you can become an observer to yourself, and you can do that on an ongoing basis, that'll help you reflect. But by doing that, you might become more self-aware. And there are always times when all of us can do things better. There are always times when each of us will do things really well. So part of this isn't just about reflecting on the difficult situations. It's also about reflecting on those things that work well and remembering that we need to celebrate our successes as much as we really consider and learn from our failures. And it's both of those that we need to think about when we're reflecting as part of our self-awareness. Now, nobody's perfect, but we have to have that degree of insight to be able to recognize ways of doing this. At taking time, it might be about keeping a journal, writing things down. It might be when you feel a certain way and afterwards taking some time out. Also worry about or think about how you plan your day. Try and build in some time where you've got moments yourself just to think through what worked, what didn't work, why something worked. Can you replicate that again? What sort of environment was there? Were there people that you came across that made you do something better? What sort of team do you have around you? All of these things are part of self-awareness. And there'll be times in your life when you'll be more self-aware. Other times you might be less self-aware. That's okay. And that's not a bad thing. It's just circumstance. But just try, if you can, to take a moment to reflect, to be the observer. And by being the observer, you'll probably learn a bit more about yourself and others around you. And that might help change the way in which you're able to interact.
Wow, thank you so much for sharing that, Sam. My final question to you is this: what do you want to leave the audience with tonight? What do you want to say to them that they remember that for the rest of their life? What do you want to say?
The most important thing for anyone listening is don't give up. Sometimes it's going to be really hard and really difficult. There'll be times when you think about quitting. There'll be times when you think about something being too difficult and you don't want to do it. Don't give up. Talk to people. Get some ideas. Share what you're doing. Ask for help if that's what you need. But don't take no for an answer, and focus on what you believe in. And if there's something you want to achieve, you will achieve it. So take time to get it right, but whatever you do, don't give up. And there will always be people out there that are willing to help. And you'd be surprised when you ask another human being for help. In most cases, I'd be surprised if you don't get that help. So look after yourselves, look after each other, but whatever you do, don't give up and make a difference.
Thank you so much, Sam. This has been a wonderful conversation. I don't know if you can see this or not. I'm really excited. I had a very beautiful and very insightful conversation with you. I was not expecting this at all. Thank you so much.
Well, Asad, I wish I could see you, and it's a shame that the powers of the internet have prevented our screens from sharing at the same time. But I really enjoyed our discussion. I really like what you're doing, and I'm sure that your series and your work you're doing is going to inspire lots of doctors there and lots of other clinicians to at least achieve their aims and their ambitions, and hopefully learn about different career pathways that they can have, and recognize that they won't always be in healthcare, they won't always be in medicine, but the skills that they gain will be able to make a difference in so many different walks in life. So well done for putting on such a great lineup.
Thank you so much. This means a lot to me, Sam, and thank you so much for your time. It has been amazing, and I definitely look forward to having another session with you sometime in future. Thank you so much.
You're welcome.
Have a nice day, Sam. Thank you for coming. Allah Hafiz.
Bye-bye.